Good evening, and thank you for joining us for the first in a series of webinars where you will get to hear directly from our physicians about what is happening here at Newark Beth Israel Medical Center, not only at our hospital, but in our community, and what you can do to take care of your health. Today, we're fortunate to have Dr. Eric Wasserman, Chairman of Emergency Medicine at Newark Beth Israel, who did an amazing job of managing the emergency department through this crisis. And Dr. Christian Engell, who has shared his birthday with us today. He is the chairman of infection control here at the Beth, and he worked around the clock to make sure that we were prepared for this crisis. Since this pandemic started, we treat close to 1,000 COVID positive patients, and at the height of the pandemic here at Beth, we had almost 300 patients in our hospital. Today, we just have a handful. It's 4 COVID positive patients in Newark Beth Israel today. We have resumed normal operations, elective surgeries, outpatient care, and you will hear in a moment our emergency department is open and ready to see patients. But as we watch what's going on in the country, it's crystal clear that we're not out of the woods yet. We have to continue to do social distancing, hand washing, and masking at all times. We cannot afford to let our guards down. We have to stay safe. We have to protect each other. I want to thank all of you who have supported us during this very difficult, challenging time at Newark Beth Israel. The salutes, the food, the prayers, all of that helped to inspire and motivate us and helped us get through a very difficult time. I could not be more proud of our staff during this pandemic. We all rallied together, and I think we gave our best effort during a very challenging time. So let's get started. Now I'm going to turn it over to Dr. Eric Wasserman.
Thank you so much, Mr. Terry. First off, let me tell you a little bit about myself. I've been an emergency physician for 20 years and chairman of the emergency medicine department at Newark Beth Israel for the last 10. I spent the first 10 years of my career in Jersey City, so I'm somewhat familiar with health concerns that are common to urban communities. Never in my career, though, have I nor any of my colleagues seen anything quite like this virus. It seemingly came out of nowhere and swept across the globe over a matter of a couple of weeks. If you recall, early attempts to contain COVID outside our borders by screening travelers from abroad were largely unsuccessful, and person-to-person or community spread within the U.S. occurred rapidly. Back in January and February, before COVID hit, we were seeing roughly 300 patients per day in our emergency department. But by April, that number had plummeted to fewer than 100 visits per day. Although the emergency department felt empty, it really seemed like every patient who showed up had COVID-like symptoms, namely fever, cough, shortness of breath, and fatigue. Hypoxia or low oxygen content in the blood was commonplace, and sicker patients required ventilators to help them breathe and to keep them alive. Our inpatient units and ICUs filled up quickly, but our hospital leadership managed resources in such a way to ensure that we had a bed or a ventilator available for every patient who needed one. Our top priority then, as it is today, was making sure everyone who came to the emergency department was safe. Early on, we set up a tent outside the building to rapidly assess less sick COVID patients who were well enough to return to their homes. Inside, we separated sicker COVID patients who likely needed to stay in the hospital from non-COVID patients who came really for other reasons. Keep in mind that patients with serious problems like heart attacks, strokes, sepsis, surgical conditions, and trauma were still arriving and being cared for in our emergency department, but they represented only a fraction of the overall visits due to the large number of patients presenting with suspected coronavirus. Now, fast forward to July, and I'm happy to report that really all of that has changed. And this is what we mean when we say the curve has flattened. Now, patients presenting with signs and symptoms of COVID are few and far between and represent, a small fraction of daily emergency department visits. despite the fact that twice as many patients are coming in now as compared with 2 months ago. And that's really positive news. And I think it speaks volumes about our community, who followed recommendations to socially distance. They stayed home if they were feeling well. They wore masks, they washed hands frequently, they cleaned surfaces, and so on and so forth. Newark Beth also mobilized resources quickly with screening protocols at hospital entrances, masking of all staff, patients, and visitors, and rigorous hand washing practices. So, after a challenging spring, I think I can confidently say that it's safe to visit our emergency department if you are feeling ill and think that you require emergency care. All areas are open, clean, and fully staffed with healthy employees. The adult, geriatrics, pediatrics, and psychiatric units are fully functional and presently caring for patients with much of the same ailments as we had been seeing before COVID. Our cardiac, cancer, sickle cell, dialysis, diabetes, hypertension, and behavioral health patients, among others, are slowly returning. But I can't emphasize one point strongly enough. If you are experiencing chest or abdominal discomfort, shortness of breath, weakness, numbness, severe pain, fever, emotional distress, etc., and you feel that you require emergency care, please don't stay at home. Don't hesitate. Come to the ED so we can care for you. You don't need an appointment, and we never close. So now that the curve in New Jersey has flattened, many of you are probably asking, what does this mean to me? And what do I do now? Well, why don't we explore that a bit? I want to thank you for sending in questions in advance, and I'm going to try and answer a few of them as best that I can. So first question that we have from one of our viewers, what can you do to protect the safety of the public when they come to the hospital for a doctor's appointment or emergency room visit? Well, that's an excellent question. So what you're going to find when you go to the doctor or the emergency room these days is universal masking, social distancing, screening, and cleaning. All right, when you arrive at our emergency department, you have your temperature taken. You will be asked to answer some simple screening questions. You will receive a mask if you're not wearing one already, and you'll be required to wear it while you're inside the building. Once inside, you'll notice fewer people and fewer chairs in the waiting room. We actually remove some of the chairs to ensure a 6-foot distance between individuals. We also have an environmental services team dedicated to cleaning only the emergency department. And there's, in fact, one person whose sole job it is to disinfect high-touch surfaces and sanitize the seats. So if you're not having an emergency, your doctor may wish to schedule you for a telehealth visit. So you can see the doctor from the comfort of your own home if that is what you prefer. There's also an RWJBH telemed website where you can select from board-certified physicians, read reviews, and schedule an online urgent care visit with a physician of your choice. So hopefully that was helpful. All right, so the next question I have here is it safe to come to Newark Beth Israel Medical Center while there is a pandemic moving across the country or the world? So another good question. And the answer is emphatically yes. The hospital is probably the safest place to be since we have seen the worst of this virus and we know what it takes to stop its spread. We are all sanitizing our hands before we walk into the building and exam rooms. We are wearing masks. We are screening all of our patients, visitors, and employees at all of our entrances. We are universally testing all employees for the virus. And we are COVID testing all inpatients prior to them assigning the beds in the hospital, as well as all patients undergoing procedures. So honestly, we are taking so many precautions that the hospital might actually be the safest place to be other than your home. Okay, I'm gonna field one last question here. Are there any preventive measures that people who have currently tested negative for the virus can do to help build their immune system? One thing I have heard is to take vitamin C tablets or gummies. I've heard that too. All right, and that's a fantastic question. So there are a lot of claims out there that medications, herbal supplements, or other substances can prevent or treat COVID-19. But no real scientific proof exists that any of it actually works. Unfortunately, there is no magic pill, at least not yet. While many people take vitamin C, vitamin D, zinc, green tea, echinacea to boost their immune systems, research hasn't really shown that any of these can prevent you from getting sick with COVID-19. So the best advice that I can give is to maintain a healthy lifestyle, take any and all prescribed medications by your doctor, and avoid exposure to infected or symptomatic individuals. While the pneumonia and flu vaccines won't protect you from COVID, they may prevent pneumonia and flu, two equally dangerous diseases we're likely to see more of in the upcoming months toward the end of the year. So in closing, I believe you'll feel comfortable with all the steps that we're taking to keep you safe at Newark Beth Israel Medical Center. And our emergency department staff is excited to welcome you back to the Beth if and when you need us. So at this point, I would like to turn the program over to my colleague and friend, infectious disease specialist and chair of infection control, Dr. Christian Engell, who is going to talk more about how you can protect yourself when you are outside of the hospital. Dr. Engell?
Thank you so much, Dr. Wasserman. You know, I first came to Newark Beth Israel 18 years ago, and I've been here most of the time since. And I've been in charge of infection control for 4 years. I'm always amazed by these home remedies that people take, and your talk was spot on, and your answers were great. And I do, just for the record, agree that the hospital is one of the safest places you can be right now because of all the precautions. I do wish we had a vaccine for the virus, but we don't yet. But there is a lot we can do to stop the spread of the virus. Essex County was one of the toughest hit counties in the state of New Jersey. In fact, the country, there were 2 counties in New Jersey that had more cases, but Essex County, unfortunately, had more deaths than any other county in New Jersey. Luckily, we did, with a lot of work from all the citizens of New Jersey, we were able to flatten the curve and then bring the numbers down to the level where they are now. As of yesterday at 1 p.m., there were only 43 new cases of COVID in Essex County, New Jersey. So what does that mean for us as we go about our daily routines, as we try to enjoy our summer and get our kids back into school in the fall? How do you protect yourself every day? Well, there are a couple of points I'm going to keep coming back to, and that is, first of all, how do you protect yourself? The social distancing is very important here, staying within 6 feet of people around you. That's about 2 arms lengths. Wearing a cloth mask is important, washing your hands frequently, and cleaning areas around you that are touched often. That is the thing that we can do to really decrease our risk. What other things can we do to decrease our risk? Well, we can stay away from large groups of people. That's associated with a greater likelihood of COVID. The more time we spend in these groups, the higher the risk of COVID. And finally, if the levels were to go back up again, like they have in other parts of the country, then that would certainly also increase our risk when going out. So what does that mean? What does that mean when we go to work, when we are in large gatherings, and when we're in school? How do we keep ourselves safe? When you're at work, and those of us that have to go to work are first of all thankful that we can, but we have to keep ourselves safe. That means it's best not to share your pens, your smartphones, keyboards, and when other people do touch the items that you touch every day, to disinfect them frequently. Something looks dirty, clean it with soap and water, and then disinfect it. Also, make sure you wear your cloth face mask in order to keep others safe, but also to prevent you from touching your face and getting infected. And remember to stay at least 2 arms length away from other people when possible. Now, we know in a work environment that can sometimes be tough. So if you can do some of the meetings remotely on a webinar just like this one, that's a great way to stay safe. Now, many of us are lucky enough to either be able to walk to work or to ride a bicycle to work or to drive alone in our cars to work, but some of us need to take public transportation. What should that look like if you're trying to be as safe as possible? Well, when you're leaving the house in the morning, you wash your hands. That's to keep the people on public transportation safe from you. You then put on your mask, and that mask stays on you pretty much all day. You try not to be in large crowds. You try not to touch things that you don't need to touch. And then when you get to work, you go straight into a sink and you wash your hands once again, and then you proceed with your day. And that's a little bit about keeping safe at work. Now, how do you protect yourself in large gatherings? One really good trick is, especially when you're out and about, is to carry some hand sanitizer along with you. Having a 60% alcohol hand sanitizer, which is known to kill COVID, it could be higher, is a good trick. Also, you want to avoid shaking hands, even fist bumps, high fives. They can make you feel good, but they can also make you sick if you're touching other people. If you're in indoor public spaces like restaurants, game rooms, gyms, lounges, make sure that there's some degree of staggering of when people come in. And make sure that the owners are actually actively monitoring for social distancing. The last thing you want to do is to go to a restaurant, spend a lot of money on it, and be bothered the whole time by someone who's not taking the correct precautions, and you feeling that you have to tell them to wear a mask. The owner should be doing that. Disposable utensil dishes are good. Salad bars, drink stations, obviously where everyone goes, they're less safe and should be avoided. The most important thing for you to remember is, as I said before, the more people you interact with and the longer you spend with them, the higher the risk. So just keep that in mind. Now, how do you protect your kids in school? I know many of us are worried about this. I have 3 kids myself, and I think often, I don't want to say I'm worried, but I think often, what are we going to do when school comes around? And the current CDC guidelines for schools is based on community spread. So the amount of precautions the schools will take will depend on whether there really are no cases in the county or whether you're experiencing an active outbreak. Obviously, in that setting, it probably would be a remote learning. It's important to keep in mind, though, that children are not as impacted as adults by COVID. That doesn't mean they can't get COVID. It doesn't mean that they can't have COVID-related illnesses. And it certainly doesn't mean that they can't spread it to adults, but it's a very different disease in many ways in kids. Getting kids outdoors is very safe. The ventilation outside is better. It's natural. Being out in the sun, running around. I think that's really what you want, especially in the summer months, want to encourage your kids to do. Sitting inside in the basement playing Xbox with 5 other kids is probably a relatively high-risk activity. And finally, a couple take-home tips before we get to some questions. Most people are wearing face masks. Everyone should. Please remember that when you are wearing the face mask, when you touch it, when you move it, you should wash your hands before and after. Else you risk touching the outside of the face mask, touching your nose, touching your mouth, and you can transmit COVID that way. Hand hygiene obviously is very important, especially if you have to have the right hand sanitizer or wash with soap and water. And as I mentioned before, being in a well-ventilated area is important. Open windows outside, good air filters can all play a role in reducing the spread of COVID. If you're caring for someone who's sick and at high risk for getting the virus, hugging, kissing, sharing food and drinks, that can be nice, it can feel nice, but it's not a good idea, which is unfortunate because it's how many of us convey that we're caring for them. But in this case, caring for them and caring for yourself is not hugging, kissing, and sharing foods. Making sure that there is good room where you're interacting with them and that there's a lot of space, so when possible, you can keep a distance and good airflow. I hope that addressed some of your questions, but there are a couple questions about masks and immunity that I would love to address. First of all, is it necessary this is one of the questions, is it necessary that I continue to wear a face mask considering my pre-exposure and my immunity to COVID? And we've learned a lot about COVID over the last 6 months, but there's really a lot we don't know. So yes, most people think that having antibodies may provide some degree of protection, but we simply don't know how long that protection lasts. We don't know how thorough it is. If your immune system's not strong, you could still be at risks. And we do know that people who aren't having symptoms can still spread the virus. So I strongly encourage everyone to wear a face mask when they're out and about. And I also, as a public health interested physician like we all are, I think the mask set a tone for everyone around us. You're saying that, to put it simply, wearing is caring. Wearing a mask shows you care about the people around you and keeping them safe. And don't forget, it falls right around the corner, and once flu season arrives, now you have 2 good reasons to wear a mask: to protect yourself from the flu and to protect yourself from COVID. The next question from one of our participants is, should school teachers wear N95 masks? This is a great question. It's not easy to answer. There's been a lot of debate on what type of masks are right in what settings, but I will say that surgical masks are great at preventing spread to others. Though it is true that a lot of people feel that N95s might give you an added layer of protection. Whether that is what you decide to use, it depends the setting you're in, whether it's going to be high risk, whether people are going to be coughing on you. That's when we use it in medicine, when we're going to be very close with people's secretions. And if your immune system's not very strong, it may be worthwhile to consider an N95 mask. But masks, the individual setting and mask choice varies amongst individuals and settings. So with that, I'd like to thank you for your time, and I'm going to turn this over to my colleagues, Darrell K and Dr. Eric Wasserman. Thank you so much.
Thank you, Dr. Engell and Dr. Wasserman. Some of the things that I learned were new and some of them were affirming. So I have a question for Dr. Engell. Dr. Engell, at the beginning of your talk, you mentioned the coming vaccine. How close are we to getting a vaccine for this virus, and what can you tell us about the development?
That's a great question. And so a lot of countries are working on vaccines. Obviously, a lot of hope is being placed on being able to give something to all of our population to prevent the virus. I remember hearing Dr. Tony Fauci talk about this topic 5 years ago, and he said, I wish that we could develop a system where we could bring a vaccine to testing in 6 months. And we've actually done that as a country. We haven't tested it yet. We don't know how effective it is. We don't know how safe it is. But in the last 6 months, we've done something that was unthinkable. We have come very close to creating a vaccine that has gone through phase 1 trials. Hopefully, and I predict this may happen over the next 6 to 12 months, we'll be able to use it in the population if all goes according to plan. But that's still a long time away, and there's still a lot of damage that COVID can get to before we get to that point. So it's important that everyone really does all the things that both Dr. Wasserman and myself mentioned prior to this.
Thank you. Question for Dr. Wasserman. Dr. Wasserman, I know a lot of us are anxious about the fall and the upcoming flu season. How can you tell whether you have a cold, flu, or COVID-19, and when should you see a doctor?
Well, that's a very good question, Mr. Terry. So let me take the last part first. When should you see your doctor? Well, you should really see your doctor if you're feeling ill and you think you need to see your doctor. Only you know how you feel. Persistently high fever, chest or back pain, trouble breathing, excessive vomiting and diarrhea, inability to eat or drink, extreme fatigue. These are all good reasons to see your doctor or visit an emergency department. They're considered warning signs. As far as distinguishing between the common cold, the flu, and COVID-19, that is far more challenging since all three conditions are caused by viruses and they all share many of the same symptoms. In general, though, patients with COVID or the flu will appear sicker and patients will feel sicker than those with a common cold. And they may also have systemic symptoms like fever, body aches, or chills. Some patients with COVID are profoundly hypoxic, like we talked about earlier, with low oxygen in their blood. Some of those have also described a loss of smell or taste associated with COVID that's not due to nasal congestion. So those are unusual and uncharacteristic features of either the common cold or the flu. Viruses also tend to follow a seasonal distribution as well. So if you got sick in April, you probably had COVID. If you get sick in December, it's probably the flu. But sometimes only testing can help us distinguish between these two.
Well, thank you both for this enlightening conversation. If you're interested in learning more or have additional questions for our panelists, please contact us at the NBI virtual community at rwjbh.org or go to rwjbh.org/welcome-back to learn more about COVID-19 response at Newark Beth Israel Medical Center. Thank you.